You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, sedation dentistry. According to my first guest, he says, don't let your fear of the dentist keep you from having the smile you've always wanted or the fact that you're just too busy. He says in one appointment could transform your life. With us, we have Dr. Sheldon Sullivan. Dr. Sullivan, welcome to the program.
Thanks, good to be here.
Now, we've actually wanted you on the show for quite some time, but for people that don't know your practice, who's your typical patient and what are the different services you offer?
I'm glad you asked, Randy. That's a really interesting question. I don't have a typical patient. My patients are so diverse and so broad. We have everything from, we have Olympic gold medalists, that's a patient of ours.
All right.
We have celebrity athletes, news anchors, but I'd say the overwhelming majority of our patients are just ordinary people living extraordinary lives. We have soccer moms that spend their day running kids around from practice to school and Boy Scouts. We have a lot of retired people in our practice because of where we're located. We have people from all over the United States that come to see us, and we see teenagers. So it's pretty much all over the board who we see in our practice. The services that we offer in our practice, Randy, vary from very simple things to the hygiene services, to tooth whitening, all the way up to very complex and advanced dentistry, complete smile makeovers. We might restore someone's complete that had lost all their dentition with dental implants. It's just really, dentistry is at an amazing time. There's virtually very few problems that walk in our door that we don't have a solution for.
So you do crowns in the same day?
Yes, we do.
You have a machine that?
We have a machine right in our office. Patient can come in and they can literally have a crown done and they leave with it complete. So how it used to be when I came out of school and for years and years, someone needed a crown, you'd come into my office. What we'd do is we'd remove the decay or the broken tooth, we'd make a preparation, we'd take an impression. Remember that gooey stuff you'd bite on?
Yeah.
A lot of people gag. Well, now what we do is I just take a little camera, I make a scan. The computer.
It's like a wand camera.
It's a wand, it's just a little wand, so we scan the preparation. Then the computer generates a three-dimensional model that's a virtual model. Then I can literally design the crown right there in front of the patient. And so patients enjoy getting to watch the process of the creation and the fabrication. The other thing that's really phenomenal is I get complete control. I don't have to rely on someone else in a lab and hope they get it right. Sometimes they got it right and sometimes they'd have to go back. The patient would have to wear a temporary for 2 weeks. Maybe it came loose at an inconvenient time. So we've eliminated all that. One appointment, patient gets numb one time, they get the procedure done, they walk out, it's done. And the aesthetics are phenomenal. I mean, we can match their natural dentition so well that you can hardly even tell.
Now today's topic, is sedation dentistry.
Correct.
And I guess there's two people. The phobics, or people afraid of the dentist, and then the other group that they still don't like going to the dentist, right? Nobody likes going to the dentist, but that they're just too busy. And you could do like 6 months worth of dentistry all in one day.
That's true.
And what does that mean when you say you could do like 6 months worth of dentistry in
well,
one day?
what sedation dentistry has done, it's simply a tool. And we could talk about sedation. There's all kinds of definitions, from very minimally sedated to just controlling anxiety, for example, all the way to general anesthesia. That's the spectrum. There's a couple things that hold people back. And if you think about what holds people back in life, what is it, Randy?
Fear, I guess.
Fear, okay. So when I was a young dentist, I noticed that my patients, when in dental school, it's very technical oriented, so you're learning technical things. One thing I didn't understand is the psychology behind the patients. I was almost offended when people didn't want to come and see me. I was like, what's going on? I have all these skills and went all to school. Why don't they want to come in? And so what I learned is that there's a lot of fear. There's a lot of fear that keeps people from moving forward. And as my education improved, if you will, or I broadened my scope of what I could offer my patients, I started studying with some of the best cosmetic dentists in the country. I literally flew all over the United States and I said, who is the best? If I want to get good at what I do, who can I learn from? And I just started taking all these courses. And I had an experience, Randy, about 17 years ago. I had a gentleman in my office, and he came in, he wanted to have his smile redone. He had a lot of fear, and we were able to facilitate him sitting in the chair for that length of time by giving him some medication to take the edge off. when we got all finished with his procedure, I handed this guy the mirror, and I left the room for a minute to go see somebody. And I came back in, and this guy was looking in the mirror, and he had tears running down his face. And at first, I wasn't sure. I said, "Is everything okay?" And he says, "You don't understand." He says, "When I was in the 3rd grade, a girl in my class told me that I had ugly teeth. And I've spent my whole life hiding my smile and being ashamed until now." And it's like in that moment, it had just been taken from the guy, Randy, was 65 years old. That had a huge impact on me because I realized in that moment that I was in a position to make profound changes to help people overcome things that they've been carrying around for a long. Something as simple as a smile you wouldn't think is a big deal if you've never.
But you're a dentist.
I'm a dentist.
Of course you think the smile's important.
Of course I do, but you have to understand, Randy, because I'm a dentist, I've had the perspective of literally hundreds and hundreds of patients having those experiences. And I've just seen it too many times to discount that there's not something profound behind it.
So there's a lot of people, would you say, in Arizona that are miserable with their smile and don't do anything about it just because of their fear or the fact, the drilling noise or whatever.
Yeah. I think,
and that keeps
like I
them from
said, fear is a big one. Okay, fear is a big one because all of us have had some type of experience in our life that has paralyzed us in some way. Maybe it's a dentist, it could be lots of different things. So what we've done is we've created this meaning around that experience and we carry it with us throughout our lives. Many people, because the old way of dentistry, Randy, has caused these scars, if you will, and people carry them with them even into adulthood. So what they do is they just avoid going. They just avoid going until things have stacked up to where they finally look in the mirror, or a spouse or someone they care about says, "Hey, you need to do something about it." Or they're in the workforce and they're trying to advance their careers and they feel like it's holding them back. So that's...
And you get the people that their mouths are pretty bad, right?
I do.
Like the doctor of last resort.
Yeah. Well, everyone comes in, Randy, and something I hear commonly is they say to me, "Dr. Sullivan, mine's probably the worst you've ever seen." Okay. Everyone seems to think that
because what? They don't see it? Because people like that don't smile?
Well, they're embarrassed. They're embarrassed about it, and they feel that we're there and we're going to make judgment, and we're not there to make a judgment. We're there to help them transform.
So you feel like you're changing people's lives?
Oh, absolutely.
We've talked.
Yeah.
Really?
It may sound like a bold thing to say. Maybe it can come across arrogant, but I could literally tell you hundreds and hundreds of stories and people that have written me notes and thanked me. And I had a lady say to me the other day, she said, "Dr. Sullivan, there's not a day that goes by that I don't look in the mirror and I don't think of you." And I'm like, wow.
Is that right?
I haven't had that impact on a woman in a long time, but she thinks about me every day when she looks at her smile. And that makes me feel good because I know I'm making a difference for people. Yeah, it's my profession. I get paid to do this, but it's more than that. It's something I'm passionate about because, when it can elicit tears and it can literally change people's outlook and I see them, they walk in the office.
Like their self-esteem is totally different?
They walk different. They change their hairstyles. They make other changes in their life. Maybe they get on a fitness routine that they've been put in. It somehow sparks something in them that gives them a new sense of themselves. Because, at our core level, Randy, all of us want to feel good. We want to look our best. And, we're in a society today that puts a high emphasis on that, right or wrong. It's just the world that we live in. And, people that have smiles that are unattractive, it holds them back. You think in the movies, people that are portrayed, the bad guy is always portrayed with he's got bad teeth.
Yeah, they always have the great teeth.
You ever seen the bad guy with a great smile? Not very often. And so, there's just been study after study that people are perceived to have higher intelligence if they have, a better smile, things like that. And so it really does make a difference.
What are the different levels of sedation that you use in your practice?
Well, sedation has a broad spectrum. There's anything from what we call anxiolysis, which is just a fancy word to reduce anxiety. That might be minimal sedation. It might just be something that just, like a chill pill. Okay. It just helps take the edge off.
You're licensed, special license for this? Not all dentists could give oral sedation?
Well, there is a permit that's needed depending on how it's administered, Randy. Right. There are state regulations on how that's done, and then then it goes on through all the way up into general anesthesia. Now we don't do general anesthesia in our practice, that requires special permits and special training. That's usually a board-certified oral surgeon is who would do,
Okay.
or an anesthesiologist. Now, we sometimes have an anesthesiologist come right into the office, and if someone requires that level of sedation, that's available. But our garden variety, the most of the patients that we see, we utilize what we call conscious sedation. That means if you came in, Randy, to see me and we were going to say we were going to sedate you, that doesn't mean you're going to be comatose and you're out, okay?
Yeah.
You're still awake. You're able to respond to, you know, what I ask you to do. If I ask you to bite or open, you can do that. You're maintaining your airway, things like that. So it's just some people fall asleep a little bit and some people don't, but what they are is they're relaxed.
So you're able to do like a lot of stuff,
Yeah.
like 4 hours worth of stuff. Mm-hmm. And I think you told me that the patients, when it's all done, it didn't seem like very long at all.
It didn't, and you know, what still amazes me, Randy, is sometimes these patients are in the chair for long periods of times if we're doing like a full what we call a full reconstruction. And when I see them the following day or a few days after and to check on how they're doing, you know what many of them say to me?
What's that?
They say, well, what exactly did you do? And it still astounds me the amnesic effect that this has, because they sat there and they were completely engaging with me, but they just have kind of a blurred recollection of what went on during those hours of procedures.
And by the way, for people just tuning in, we're talking about sedation dentistry. Don't let your fear of the dentist or the excuse of, I just don't have the time to get into the dentist, to keep you from having the smile you've always wanted. And we were talking about, the type A personality. Some of the CEOs they're very busy, and they've got the money and the car and the watch, but they've got this old smile.
Yeah.
And then you told me about this plastic surgeon.
Yeah.
That works within your practice.
Yeah. So let me just show you.
So this guy's a well-known plastic surgeon where you are.
This is Dr. Hobgood. He's a very well-known plastic surgeon in Scottsdale. Great guy. And he came to see me and he said, Dr. Sullivan, I'm just noticing that my smile just starting to not represent me. So if you take a close look at his teeth, what you'll notice is there's some wear that was occurring. And I call it pathologic wear, like his teeth didn't match his age. His teeth were aging him. And
good point.
They had kind of a wear pattern. They're starting to get chipped on the edge. And we could have a whole topic on tooth wear, Randy. I mean, there's lots of different reasons for tooth wear and the kind of the pattern of wear, but saving all that detail, he just didn't like the way it was starting to look. And this guy's in the business of making people look good, and he felt like, hey, I need my smile to represent what I do, because he's extremely talented. And so we sat down with him, and just like I do with all my patients, whether they're a plastic surgeon or soccer mom, it doesn't matter, they get the same experience. We start with photographs. I take extensive photographs on each patient. We sit down in the consultation room, and we just go through the photos, and I say, Randy, if you were my patient, I'd say, Randy, tell me what you don't like about your smile. And you'd say, well, this and this and this. And I might say, hey, this is what I see. How do you feel about that? And then it's kind of like a process that we go together. So I'm not saying, hey, Randy, this is what you need. I say, what is it you want? And I'll tell you whether I can achieve that. And we make sure that we're, on the same page. And then the photographs serve as a vehicle to facilitate. There's no communication problems because we're really clear in the process. Then from the photographs, the template takes place, and then we use that as a blueprint.
Now, with this facial plastic surgeon in your town,
Yeah.
So it wasn't the fear. He wasn't a phobic, but it was just he just didn't like the whole thing.
No, Dr. Hobgood's issue was not fear. He's a medical professional. He understands what's going on. But his was just a time thing. He's a busy guy. I mean, he's successful and he's busy. And just to take the time out of his life and his day to get over to my office and do this was his biggest hurdle. So utilizing sedation, even though he doesn't have fear, we just get him comfortable. We can get a lot done in one visit. And then we go into the laboratory phase. And the next visit I see him, he walks home with a completely transformed smile.
Take a look.
And this is what he looks like. And
Big difference.
that took 2 visits, Randy.
With sedation, he's just relaxed.
Yep.
Wakes up. Somebody gives him a ride home.
Yeah, we don't let them drive home. We call them drunk drivers at that point. So they have to have a driver and someone to, get them home safely.
Well, what's nice, I mean, here's a guy that's in the beauty business, and he saw the importance of a smile.
And what was interesting about while we were treating him, of course he's, engaging in the process. And what he said to me, he says, Dr. Sullivan, I really, as a plastic surgeon, underestimated the impact that, dentistry has on the lower third of the face. Because if you think about it, he's working like, from the nose up, and I'm down here. But if you look at these shows, Randy, like Extreme Makeover, for example, And I would watch these shows with interest because, I'm a dentist, and then
Yeah.
Dr. Dorfman was on there. He's real well-known cosmetic dentist in Beverly Hills. And I would always find it interesting that these people had all kinds of things done, but the smile was the thing that really popped and the thing that really stood out. It just really makes a difference.
So when you see, because my plastic surgery buddies say the same thing, Randy, nowadays, the modern plastic surgeon is referring them to a dentist to take care of their missing teeth or whatever the situation. But, after we talked, around town, I'll see people that they appear to have money and nice things, but they've got this old smile.
Yeah.
So what is it? Is it just the fear of the dentist? What's your take on it? Or they don't know how important it is? Or it just seems like a hassle, like doing your taxes?
I think it's both. I think for some people it's fear. It's fear of, fear that it's going to hurt. It might be fear of the unknown. It might be fear of cost. Those are all different types of fears, right? But for, like in his case, it was just a time thing.
Yeah.
It's just something that he just put off, and it's just something that creeps in, and we're used to seeing it. You wake up with it every day. You kind of just become accustomed to it.
Yeah.
Until something sparks in you for whatever reason. There's a lot of triggers that I find in my patients, like they walk around with an unattractive smile for years and years. 20, 30 plus years. Like the gentleman that was 65, he's like since third grade. Like what provoked him? And then there's a lot of different life events that could stimulate someone to want to make a change.
Like people getting married, their kids are getting married.
Yep.
They're single.
Changing careers, maybe they had a change in marital status and now they're back in the dating circuit. I'm not saying that, giving you a great smile is going to give you a great relationship in your life, but it certainly doesn't hurt.
Do you do nitrous? You do nitrous.
We do
there,
nitrous,
right?
yeah.
And we talk. I love nitrous. Now, I said, look, I told you, I would go to the dentist every 3 or 4 years just because it was a hassle. Now that they got me in on nitrous, by the way, I tell all my friends, you got to do the nitrous. It's like you're bummed out when it's over. So even when you're there with the deep cleaning, it just makes sense to me that you would want to do it this way if you had it in their choice. Here's what I want to ask you. Do you think it's insensitive of dentists? I know you want to be positive, but I meet dentists that say, Randy, I'm good with my patients. I calm them. They don't need any kind of sedation. They don't need nitrous. They don't need anything. Yeah. I don't think they get it or something.
I don't think that's true because I like to think that I'm a guy that listens and pays attention. But there are those people that just need something else. They just need something else. But what I do see is when some of those fears start to break down over time after they have multiple visits in my office, it's like you almost just see that their shoulders drop. There's just a different countenance about them over time. And so that may be true initially, but when they come in with that, I'm not going to just think I'm going to be a nice guy and get them over whatever that trauma was.
So sedation, especially if they don't like.
Absolutely.
Now, and you're a very popular guy in Phoenix. I guess you've been the top dentist every year for many years in the Phoenix magazine. And that's voted by your peers.
Correct.
Right?
Yeah.
So they must like you.
I don't know.
Do you get referrals, by the way? Because you do some complex stuff?
It's interesting, Randy. The other day, my office manager brought me a list because we track, how do people come to see us, and are they find us online? And our number one source of referral was other colleagues, other dental specialists.
Why does a dentist send you a patient?
Well, it may be
like,
something.
What do you do that they don't do?
It may be something that they don't do, in their practice.
Like?
If it's an orthodontist, they don't do general dentistry or they don't do, implants or reconstructive dentistry. So, or if it's a surgeon in the community, a surgeon is a specialist, but they need someone, I kind of call myself the general contractor. If you're going to build a house, you'd hire a general contractor, and that general contractor would utilize, the framer and the plumber and different things to get the final outcome. So I'm kind of like,
so like for dental implants and things like that, oral surgeons might send you.
Exactly. Or because the oral surgeon, sometimes a patient might end up in the oral surgeon's office because they had an infected tooth, it was going to need to come out, and then now they need to know, hey, where do we go now? The surgeon needs someone that's going to facilitate the treatment plan and, implant it.
Now, I told you to bring some photos if you had them. We could show a few of people that sedation lowered the barrier and got them to take care of their smile.
Well, here's a great example of that, okay?
All right.
This is a lady, very busy, very busy. Her and her husband have a business here in our community, and she just put off, if you listen to her, she'll say, I just put this off just because of time, I'm just busy and busy, busy. And if you look closely at her smile, you know, she just had some things that she didn't like. There's metal showing and recession and without divulging a lot of details, she just has gotten to that point where it was, you know, time to make a change. So this is a woman who had general anesthesia, and she literally went to sleep, and she woke up, handed her a mirror, and she had a completely different smile.
They have no memory most of the time?
No, not when you're asleep.
And you bring in an anesthesiologist?
Oral surgeon in this case.
Okay.
We work together on this. Here's another case that I love, Randy. This is a gentleman who came in and he was seeing our hygienist routinely. And my hygienist said to him, you know, he has some health problems that have contributed to tooth loss and things like this. And she's like, you know, would you like to have a solution that's just a one-time solution? You don't have to keep dealing with this. He's like, I'd love it. I didn't know there was such a thing. So we educated him on some of the things that were available, and he's like, when do I start? And then this is him today. Okay?
Very nice.
That's general anesthesia, goes to sleep, wakes up with a new smile. And he said to me when we were finished, he said, Dr. Sullivan, I expected to have some pain afterwards, and the oral surgeon that sedated me gave me some pain meds. He goes, I didn't take any of them. He goes, not even a baby aspirin.
So the oral
So
surgeon,
that's what sedation can do.
so
for
the oral
people.
surgeon comes in and they softly go to sleep
Yep.
in a way, and they wake up, it's done.
They wake up, literally, they have no memory of it because they were asleep. It'd just be like if you went to the hospital and had surgical procedure. Do you remember it?
Yeah, you don't remember it.
You don't remember it.
It seems like the only way to go, especially for big,
For these types of cases where we're doing that much at
like
one
dental
visit,
implants
yeah,
and veneers and rebuilding mouths.
yeah, absolutely.
You know, and I want to tell you, people need to know it's a real interview. I'm not trying to endorse you, but just because I've had sedation in my life, and I'm going, it's the only way to go.
Yeah.
You got to try it, right?
It makes a
I know you have
difference.
more photos. What else
Yeah.
do we have?
Here's another fun one. This is another busy guy. This guy's an attorney. He came to see me from out of state, and he's like,
That looks pretty bad, by the way.
Yeah, it looks pretty bad. He's a trial attorney, and he found me even though he lives out of state. He has a colleague that lives here in Arizona, and he said, "Hey, I need to get some work on my teeth." You know, where he was just calling his buddy to get some advice, and he's like, "No, you need to come to Arizona, and you need to have Dr. Sullivan treat you." And anyways, this is him. But I want you to notice, you know, yeah, he goes to sleep, the procedure's done, but look at what it does. This guy's walking around with a completely different look. Now, as an attorney, which guy looks more credible to you?
Well, yeah, after it's all done.
Yeah, it's pretty obvious.
And he's more handsome. He looks younger.
Yeah.
Looks more educated.
Yeah. Yeah.
And so his just fear of the dentist, not wanting to get, just kept him from all those years from doing it?
You know, it's been several years since we treated him. I can't remember whether it was fear or just apathy and just life, you know, got in his way. But it just happened in 2 visits, you know. Preparation visit, take some medicine, go, you know, be kind of loopy during it, and then another visit for delivery. This type of dentistry, Randy, in sedation is not just for, you know, seniors but you know, I see kids in my practice. When I say kids, I don't mean little kids, I mean the teens. Mm-hmm. And often what happens is, like this young man, sometimes people are born with missing teeth. We call it congenitally missing teeth, and it can really affect their self-esteem because these are developmental years. They're in high school, they're in junior high, and it affects them. So this is a good example of this young man going to sleep, having implants placed, and transformed his life.
So you do a lot of dental implants?
Randy, a lot of implants in my practice. There's probably not a day that goes by that I'm not involved with implants at some level in my practice. Everything from a denture wearer that wants a denture that's secure, that can now snap in place, or maybe they're denture wearer and they want non-removable teeth. They don't want to have to take them out anymore. Or maybe it's someone that just lost a front tooth or a single tooth. It's just literally all across the board of what we see.
But you do a lot of like pampering stuff in your office, right? It's like a spa kind of a thing.
Yeah, you know, as part of trying to make our patients feel comfortable and have a good experience, my team really likes to pamper our patients. So we have, you know, some amenities. They have paraffin hand waxing like you'd have at a spa, and heated and warm neck rolls, electric foot massager. They bake cookies every day, and just things to try to make it not feel like you're at a dental office, but you're more at a dental spa, if you will.
Do they ever say that to you? Like, this is different?
Oh, all the time. I feel like I'm at a spa when I'm here.
Okay. Yeah. So time for just one more photo.
Okay.
What else you got?
This is just a sweetheart of a lady, and she's from Russia. She grew up in Russia, And so you can imagine some of the stories she's had about dentistry, you know, in her childhood and you know, her smile reflected it. She stayed away for, you know, a long time just because of some of the traumatic things around it, or maybe what it meant to, or she didn't know what was available. So she came to see us. We sit down, we talk about what's available, and this is now what she gets to walk around with. So this is another example, Randy, of a woman that comes in for whatever reason, has put this off. We give her some medicine, help her relax, and we get years and years of neglect or dentistry that wasn't done, and it happens in literally 2 visits.
As a dentist, is it easier to work on a patient that has maybe some oral sedation because the people are more relaxed? Because it's definitely easier on the patient. What about you?
I'd say it's easier for me because I can focus less on worrying about their comfort and focus more on what I'm doing. So in that sense, it's easier for me, yes.
Final message, somebody watching this, but they're afraid of the dentist. Or they're just saying, you know, I just don't have the time, right? But they hate their smile.
Yeah.
Or it hurts when they eat and chew. What do you say to them?
Well, what I'd say to them, Randy, is there's really no reason to have those things hold you back anymore, because we have the technology, we have the expertise, we have the ability to take away that in a very short amount of time with very little discomfort. And you know, the benefits, you know, just like when I said I was in the dental chair, I didn't like being there. You know, I mean, I'll be honest, it's not something I want to do, but I like the outcome. You know, when I go to work out, sometimes I don't like the way it feels, it burns, it hurts, but I like the outcome of feeling good and feeling, you know, comfortable and confident. And so I would say don't let those things, you know, be a barrier to keep you from getting the smile that's going to be with you every day. Think about it, Randy. We use our smile more than any other part of our body. Like you and I are using, we're using our mouths to communicate, right?
Okay.
We use it to communicate, to share affection, to nourish our bodies. It's the most used part of our body. And so, you know, to me, you know, why not put some emphasis on something that gets so much, you know, use?
So take care of it. Don't put it off.
Take care of it.
All right, well, thank you for coming on the show. Very interesting.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.